Radhe Radhe to all, and I hope everybody is doing perfectly fine. So, today we'll be discussing a very small topic that is glomus tumor. So, how the patient presented us a 50-year-old lady, she presented with a nodule on the volar aspect of right index finger. So, here she had a very small nodule in the below the nail bed, you can see on the lower surface. So, on the volar aspect inside. So, she had a small nodule and which was very tiny. It's a measurement you can see we received a very small growth that is measuring zero point 0.3 into zero point 0.3 centimeter. But the presentation she gave was that it is a painful nodule. So that you have to keep in mind on volar aspect of right index finger and painful swelling which the lady complained of. So after the gross, we did the section and then staining of the tissue, and then what we saw under microscope was it was a benign, it showed us a benign polypoidal lesion. Polypoidal is like a polyp which is, it's a polypoidal lesion. You'll see well circumscribed which is having a proper capsule, and inside the sections what we will see is sheets and lobules of glomus tumor cells which is surrounding the branching capillary sized vessel. So you will see round two components are very important. One is your branching capillaries and the second one is the sheets and lobules of glomus cells, round to oval cells. So how the glomus cells look like? So this is the description. Round to oval cell with a bland chromatin and minimal mitosis. Focal area we can see some that spindling of the glomus cells is showing you spindle shaping. And focal myxoid area, a stroma can also be noted. So this was I was talking about. It's a polypoidal. We can see the stalk here and the polypoidal lesion, the complete round thing. Correct? Then these are well encapsulated. You have a proper capsule outside the margin of the all throughout the margin of the tumor. And here you are seeing the lobules and the sheets of tumor. And in between the empty vessels, these are the capillary of varying sizes. So high power you can see. So yes, these all are your vessels, the empty lumen thing you're saying, and surrounding that vessel, there are these sheets of the small to round oval cells. So you can see they have a very particular presentation that is perivascular. So around the vessels, these sheets are the sheets of monomorphic cells are arranged. So this is a more high power. So see, this is the small capillary which is lined by endothelial cells. Here also you can see, and is capillary ke around what you are seeing a sheet of round oval cells with moderate amount of eosinophilic cytoplasm. So all these are your glomus cells which are forming sheets and lobules and they are arranged around these small vessels. So here is the vessel, here is the vessel and these cells are surrounding it. So this diagnosis was given to me as glomus tumor. So two clinical finding which you have to remember is एक तो ये सब अंगुल एरियाज में होता है extremities you will remember and painful swelling you will remember. So these are basically what perivascular or pericytic mesenchymal tumor. So basically these are like arranged around the vessels. So you can call it like perivascular, pericytic. So these are mesenchymal tumors. So which is composed of modified smooth muscle cells. And these are arising from your glomus body. So these are basically usually commonly cutaneous. So बहुत common होता है in the subungual region of the finger. So same our patient also presented with it. And these are usually benign. Very rare cases of malignant transformation have been seen. So as I said, site is very important. Upper extremity ही 62% comprise करता है, particularly the fingers. Subungual region is the most common one which you will get it. And other sites you can have it on trunk wall, internal organs, and then lower extremity and head and neck region. So patient how presents to you like bouts of pain or that is very painful swelling. So pain and finger. If you get a history for in your spotter exam also if you get the history pain swelling in the pain and you have a this in the finger region. So then you have a histology. You have to identify the histology of the image. Always have this differential in your mind. So the patient will present to you with bouts of pain which will radiate away from the lesion and often out of proportion. Even if it is very small, it is very tender. So pain can be elicited by change and patient can have like if a patient is going from cold to hot environment, hot to cold environment or there is a tactile stimulation also, then also patient will have pain. And definitive diagnosis require histologic assessment of the tumor by biopsy or excision. So excision, histological confirmation is very important. and complete surgical excision even if it's done. So recurrence can be 10% because sometimes there can be some incomplete resection. So IHC which are important are vimentin, smooth muscle. So these all will show smooth muscle. SMA and vimentin will show almost 100% positivity. Muscle specific antigen shows you 95% and calpol in 80% cases you will get it positive. CD34 in vessel 30 to 53% will show positivity. Typically it is focal. So before you label it as a glomus tumor, so what all differential diagnosis you have to keep in mind? Myopericytoma, angioleiomyoma, paraganglioma, then other benign ethnic cell tumors like your nodular hydroadenoma, eccrine spiradenoma. So these all before we give any definitive diagnosis. So see, we have to go through the detailed morphology of the tumor and then we have to designate, like if on histopathology there are certain characteristics, so all these tumor you have to read in differential diagnosis that their typical histological feature, their clinical feature, histological feature, and if IHC, if any relevant IHC which gives a confirmative diagnosis, so you have to rule out this before labeling it as glomus tumor. So these all have a small chances. This glomus tumor has small chance for recurrence if you incompletely excise it. Or then atypical features are there which has adverse outcomes. So an atypical feature like if it is deeply seated, more than 2 centimeter in diameter, presence of any atypical mitotic figures if you are getting it. Then malignant glomus tumor, these are characterized by your marked, the nuclear ATPI is there, atypical mitotic figures are there and metastasis is seen in 40% of cases in malignant glomus tumor. So there are criteria, there are like classification of glomus tumor also. So here I am just discussing the case report. So main clinical feature of the benign glomus tumor you have to remember is pain and the finger extremities region. And then on histology, two major components. One, you will see the proliferation of the vessels and surrounding the capillaries, you will see the sheets of bland looking mononuclear round to oval cells. So thank you so much for your patient hearing. Kindly like, subscribe and share my YouTube channel Patho with MK. Thank you so much.